veteran surgeon. Appendicitis is a medical condition that requires immediate medical attention. In fact, after the initial symptoms, the patient has less than 48 hours to get surgery and have their appendix removed. General Surgeon Dr. Pedro Gonzalez explains why.
The word appendicitis means inflammation of the appendix. Okay, ordinarily talking, swelling of the appendix. What causes this? Most of the time is an obstruction. It gets blocked. Anything that blocks or obstructs the appendix, the inside of the appendix, it will give you inflammation of the appendix. And that is the way how it begins, with mild swelling of the inside. Okay, that is the first step. It is recommendable that people with abdominal pain, you have pain 24 hours, go get some help. Don't wait 2 days, don't wait 48 hours. It becomes critical.
Why is it a critical situation?
Because the inflammation progresses, okay? It gets, the swelling increases. From that inflammatory phase, which is only a little inflammation, then the appendix, the wall, gets more swollen. Then, because of the compression, it does not receive enough blood, okay? So it begins to, what we call, it gets necrotic. It begins to die. It begins to dry, okay? The walls get so damaged that it will progress to a more serious stage in which the wall already is so fragile that bacteria and toxins from inside the appendix begin to get through the wall, and they invade the abdominal cavity.
The worst case scenario is if the inflamed appendix bursts, spilling infectious matter into the abdominal cavity. This can cause an infection within the abdomen itself, a serious and potentially fatal scenario. Parents are urged to never underestimate abdominal pains in children. There are a few other symptoms you can look out for as well.
What predominates is upset stomach, nausea, vomiting. The appetite disappears. If you ask the patient, how is her appetite? He said, poor, I'm not hungry, I'm not thirsty. I just feel bad. I just don't feel like eating. I have no appetite. That is the starting, okay? And the abdominal pain, which also comes, can be mild, crampy-like, okay? And it begins around the umbilicus or the upper abdomen, okay?
The belly button.
Yeah, the belly button. Then it will shift to the right side, to the right lower portion of the abdomen. That takes about 8 to 12 hours if left alone.
Dr. Gonzalez finds it a very common trend that patients with appendicitis have usually reported having a cold or flu within the past few weeks. However, it can happen at random to any person at any age. So knowing to identify the telltale pain in the lower right abdomen can help.
If you happen to have abdominal pain, like the one we described with those symptoms, don't wait. Seek help anywhere, any doctor, okay? Before you take anyone, and especially the antibiotics. We recommend not to take antibiotics until you know what you have. Otherwise, when you find out the appendix is already ruptured, or you develop an abscess.
And that's the news. Don't forget that tonight's broadcast is available in both text and streaming video at channel5police.com.